Hi, my name is Grace Beske, and I am a first semester undergraduate nursing student at Minnesota State University Mankato, and I am in Section 2. I was one of the primary nurses for Simulation 2 on Tuesday, October 7th, 2025, and today I will be reflecting on my experience as the nurse for Simulation Reflection Assignment 1. So what aspects of my performance was I most proud of? I would say that I'm most proud of how thorough I was and how I focused on patient safety. So I started off by checking the ID band to ensure the right patient, and then the allergy band, and then asking the patient if they had any further allergies that we should be aware of. I then completed a focused assessment based on the presenting acute abdominal pain. For the pain assessment, I asked the patient to rate their pain on a scale from 0 to 10, with 0 being the absolutely no pain, and then 10 being the most pain imaginable. And then I asked when the pain started, the quality of the pain, such as it being dull, throbbing, aching, if the pain was radiating anywhere else in the body, when the pain started, if anything makes it better or worse, and what they have done to try and control the pain. For the abdominal assessment, I asked permission to roll up the gown and to also auscultate and palpate the abdomen. And I think that is important for patients to have their own autonomy and to build trust within the nurse-patient relationship. Then moving on to patient safety, I ensured the bed was low and locked, the top side rails were up, the call light and tray table were within reach, and that the environment was free from any obstacles that could cause falls. Other aspects I'm proud of is repositioning the patient and trying to improve their comfort, providing an emesis bag for the nausea, and accurately recalling the provider's orders during the SBAR phone call. What are some challenges that I faced during the simulation? I would say the biggest challenge I faced was providing the SBAR to the provider. I was very detailed with the information I provided, but I definitely included too much information. And the SBAR became too long, and I repeated things that I already stated. I need to get better at this because it was taking time away from providing interventions and getting the pain meds and IV fluids for the patient. I also did very little to include the family member in the room. I felt kind of awkward just having them sit there and watch. And my communication with both the patient and the family wasn't very therapeutic. It was more goal-oriented in gaining the information that I needed. The other nurse and I also overlapped tasks and cut each other off a few times. We didn't assign roles or delegate any tasks before we started, which led to incoordination and just looking at each other for what to do next. And that just slowed us down, and it was awkward also. So how did I manage my stress or the unexpected events? To manage my stress before and during the simulation, I had to pause a few times and take a deep breath. I did this to help me calm down and avoid panicking so I could focus on the patient and their presenting symptoms and what I could do about it. When on the phone with the provider, she asked me a question that I didn't have the answer to. Of course, it was my goal to avoid this, and that's why I did such a detailed pain and abdominal assessment. But I calmly told the provider that I did not know the answer and I would get the answer as soon as possible. So I delegated the task to the other nurse to go and get the information that the provider asked for, and was able to give the provider the answer once the nurse returned. I know this will happen when I'm a real nurse, so I have to be okay with not knowing the answer every time and then going back to reassess the patient. What feedback did I receive from my peers or instructors? Some strengths my peers listed for me included performing K-wipes, being thorough in my assessments, paying attention to patient safety, accurately recalling the provider's orders, checking allergies and vitals, and then trying to comfort the patient with different positions and providing an emesis bag for the nausea. Areas for improvement that my peers listed were shortening my SPAR and improving the flow of it, and knowing what I wanted to say before I called. Also increasing my therapeutic communication with the patient and family, acknowledging and including the family more in the care and what I was doing, getting consent from the patient for the family to be in the room while I did the abdominal assessment, because intimate areas can be exposed when lifting the gown. I should have asked permission. And then also improving delegation among the nurses so we don't overlap or cut each other off. How did this align with my self-assessment? The feedback I received from my peers was very closely aligned with how I thought I performed. I recognized that my SBAR was too long after I was on the phone for multiple minutes, and I included details that weren't relevant or necessary to the main problem. My peers agreed that I should prepare the information I want to tell before calling the provider. I also noticed with my communication, it was very task-oriented and not therapeutic at all, and my peers pointed out that I need to be more intentional about my communication and not just being a data collector. Another point of agreement was teamwork and delegation between the other nurse and I, and how we should have decided what each of us were going to do before entering the client's room. They also saw the same strengths as I did, such as being thorough, providing patient safety, checking allergies and asking if they had any others, obtaining vitals, and then accurately recalling the orders from the provider. What did I learn about myself as a future nurse through this experience? I learned that I am good at prioritizing patient safety and being very thorough in my assessments to gain as much background information as possible that could explain why the patient is experiencing these symptoms. I'm very detailed when it comes to systematic processes such as K-wipes, checking the ID band and allergy bands, asking permission before assessing and touching the patient, and making sure the environment was safe before leaving the room. And I want to be an accurate, respectful, and safety-focused nurse, and I feel like all of those actions support that. But even though I am very accurate and detail-oriented, I need to be more concise when I'm communicating with the provider using the SBAR format. I over-explained because I didn't want to miss anything, but that can delay how quickly interventions are placed for the patient who is in pain. And on the other hand, I think of myself as an empathetic person, but I need to follow through with that and provide therapeutic communication, even when I am under pressure. I missed opportunities to include the family and the patient, and I didn't really validate their feelings. And I want to be more than a nurse that just gathers data, so I will definitely continue working on that. I also learned that delegation and teamwork is necessary for efficient and patient-centered care, and not having these roles during the simulation slowed us down and caused overlaps. I now know it's very necessary to delegate these roles up front to prevent cutting each other off. So for my action plan for my final performance simulation, I developed a SMART goal, which I will list now, but I will go into detail. So for the S specific, I want to improve the conciseness and clarity of my SBAR reports by practicing with peers and utilizing available resources in the skills lab and on ATI, focusing more on components included in each step. So just knowing what each step means and what vital information I should be including and what I can leave out. The M, measurable, I want to achieve a reduction in report length that is under 60 to 90 seconds while maintaining essential information, and I want to receive feedback from my peers and my instructors after every practice session. For the A, achievable, I want to dedicate at least 2 hours each week to practice SBAR reports with my peers, even if it's outside of class, just we're on a walk. I want to practice that every day and utilize my skills lab resources and my professors for guidance on how to improve. For the R, relevant, I'm going to enhance communication skills to improve patient care and collaboration with healthcare providers, and it's crucial for my nursing career and my education right now because I need to know how to communicate with a provider effectively. For the T, time bound, I wanted to achieve this goal within the next 8 weeks before the final performance evaluation, and I'm going to give myself progress evaluations every 2 weeks to assess my improvements and just look at the quality of my SBAR reports. So going that further, the specific skills or behaviors I want to improve, I want to deliver a concise, well-organized SBAR report that clearly communicates the most important patient information and leave out the unnecessary details. This is important because a concise SBAR ensures that the providers receive the most critical information quickly and clearly, and that can improve patient safety by reducing the chance of miscommunication and having timely interventions. The strategies that I'll use to prepare, I will dedicate time each week to practice SBAR reports using realistic clinical scenarios. I will focus on keeping them below 60 to 90 seconds based on the scenario, and I will utilize SBAR templates and cue cards to organize myself and what I want to say before giving the report. And I will also record myself and get feedback from professors and my peers. Resources or support I might need. I will need a peer to partner with for practice, but it is nice because my roommate is also a nursing major, so we can practice together. But I also need feedback from instructors because they have the real nursing experience and know what vital information to include. I will also use the skills lab class and ATI SBAR tools to help guide my practice and help me self-evaluate on how I did. How I will measure my progress, I will time each SBAR report and keep it under 90 seconds like I said before, but also remaining accurate, and I'll get evaluations from everyone to make sure they're clear and organized. And like I said, I'll track my improvement in length and quality and conciseness over practice sessions over the next 8 weeks. So overall, I really enjoyed participating in the simulation because I feel like I learned a lot about myself through actually interacting with a patient or the mannequin and receiving that peer feedback in real time afterwards, and from my instructor. And I'm now looking forward to improving my skills because I see where I'm lacking, where I didn't think I was lacking before. So I know what I need to practice now. And that's all I have for my simulation reflection assignment 1. Thanks for listening.